Hello. I'm a gastroenterologist with over 12 years of experience. Over the years, thousands of patients have come to me with seemingly simple complaints like bloating, heaviness in the abdomen, and not having a bowel movement for several days. And what do we often do in response? We wash it down with coffee or simply wait. Constipation is not just an inconvenience. It's a signal that our digestive system is not functioning properly. Normally, a healthy person should have regular bowel movements at least once every 1 to 2 days, without strain, pain, or long sessions on the toilet. Nutrition and movement matter, of course, but so does hydration. Drinks are the first and most accessible way to stimulate bowel activity naturally. That's why I decided to write this series about the 5 most effective drinks I recommend to my patients. What is constipation from a medical standpoint? It's when bowel movements occur less than 3 times a week, there is straining, a feeling of incomplete evacuation, dry or hard stool, and abdominal discomfort or pressure. The causes include dehydration, lack of fiber, inactivity, stress, poor diet, suppression of natural urges, medications, and hormonal changes. Medications are not always necessary. The body can often recover if we support it with proper habits, and the first is drinking enough fluids. The intestines need water to soften stool, activate the mucosa, support microflora, and improve peristalsis. When there's not enough water, the colon draws it back from the stool, making it dry and hard. Patients often ask me whether drinking lemon water in the morning really works. My answer is yes, it works, but only if you do it correctly and understand why. Warm water at a comfortable temperature doesn't irritate the mucosa. It relaxes the intestinal walls, triggers the natural morning defecation reflex, and prepares the digestive system for food. It should be drunk on an empty stomach. Lemon adds additional benefits. It contains compounds that stimulate peristalsis, increase stomach acidity, promote bile flow, and support gut microflora with vitamin C. However, lemon acid can cause discomfort for people with gastritis or ulcers. The recipe is simple. 200 to 300 milliliters of warm water, juice of half a lemon. Drink in the morning on an empty stomach and wait 20 to 30 minutes before eating. Most people notice results in 2 to 5 days. Some feel the effect even after the first try. Avoid if you have ulcers, acid reflux, or citrus allergy. Consistency is key. The body adapts to routines, and regular use teaches your system to activate naturally in the morning. Prunes aren't just dried fruits, they are a gentle and natural laxative. They contain sorbitol, which pulls water into the intestines, as well as fiber, phenolic compounds, and potassium that promote healthy digestion. How to prepare the infusion. Take 5 to 7 pitted prunes, pour over a glass of warm water, and leave overnight. In the morning, drink the liquid and eat the prunes. Who benefits? Elderly people, post-antibiotic recovery, those with low physical activity, postpartum women, and anyone with chronic constipation. Cautions. If you have diabetes, limit to 2 or 3 pieces. If prone to bloating, combine with herbal teas like fennel. Don't take it right before travel, as the effect may be fast. Use for 1 to 3 days for cleansing, or 2 to 3 times per week for maintenance. You can add honey or combine with flaxseed for enhanced results. Flax seeds are rich in both soluble and insoluble fiber, omega-3 fatty acids, phytoestrogens, and antioxidants. When soaked, they release a mucilaginous gel that coats the intestinal walls and eases bowel movement. Who should use it? People with slow digestion, irritable bowel syndrome, gastritis, post-illness recovery, and the elderly. How to take. 1 teaspoon of whole flax seeds in a glass of warm water. Soak for 6 to 8 hours or overnight. In the morning, drink the gel and, optionally, eat the seeds. Alternatively, grind the flax seeds before use and add to yogurt or porridge. Always drink plenty of water with ground seeds. Take once daily for a week. For prevention, 2 to 4 times per week. Avoid if you have acute intestinal inflammation, allergies, or have had bowel surgery. Consult your doctor first. A powerful combination is flax at night, prune infusion in the morning. The intestines work best when they contain beneficial bacteria, probiotics like lactobacilli and bifidobacteria. These regulate digestion, support immunity, reduce inflammation, and synthesize vitamins. Kefir is a great source of probiotics, but it's important to choose a live version with a short shelf life and no sugar or additives. Homemade kefir is even better. How to take it? Drink 150 to 200 milliliters at night, 1 to 1.5 hours before sleep. You can add ground flax, bran, or honey if tolerated. Benefits. Kefir hydrates the colon, provides enzymes to aid digestion, and supports healthy gut flora. Avoid if you're lactose intolerant. If you experience bloating, start with small amounts. Other options include plain yogurt, ryazenka, acidophilin, or bifivit. Prebiotics like bananas, oats, onions, and garlic help feed the good bacteria. Ideal daily routine. Morning, lemon water or prune infusion. Daytime, flaxseed, fiber, hydration. Evening. Kefir with probiotics. Constipation isn't just a minor issue, it's a sign your body needs care. Natural drinks are the easiest and most physiological way to support digestion, gently and consistently.